Hi everyone, my name is Melanie Grant and this is C&M Glass. Today we're talking with our class 1015 for our part 1 of 2 on Introduction to ICD-10-PCS Coding, which is the International Classification of Diseases, 10th revision for procedure coding systems. Some of the key points we'll be focusing on this week are the purpose of PCS codes, how they're structured, the format of the book itself, some of the conventions found within the book, and how to select a principal procedure. So let's get started. The first thing you want to be aware of is that there's 2 different types of procedural coding systems. You should already have a good idea of what those are, but just in case you forgot, there's professional-based coding and facility-based coding. Under the professional-based coding, there's actually 2 coding manuals, which are your CPT and HCPCS that you learned earlier in this module, or in this class. On the facility side, these are inpatient services only for the facility or the hospital itself that bills for the same procedures that you may have found under the CPT, but for the actual cost to the hospital. So the idea there is to keep in mind that the 2 are very similar in their purpose, but very different in how the codes are selected and identified and what the purpose of who they're coding for. So remember that the professional-based services are for the professional, him or herself, meaning the doctor, whereas the PCS, ICD-10-PCS is facility-based services which bill for the hospital or the facility itself. Not always an inpatient hospital, because this can also include nursing facilities, long-term care facilities, and short-term care facilities that all consider patients to be admitted or inpatient. So keeping that in mind, you want to remember that it's always going to be facility-based for inpatient services. Okay? So that's a little bit about the purpose. As you get to know PCS a little better and maybe even go on to our next class, which will be in 2021, discussing PCS in detail, you'll understand a lot more of that. But if you have questions or concerns about how to identify the 2, feel free to ask. Okay, so the structure of PCS is quite a bit different. Now, one of the recommended code books for you in this class is the ICD-10-PCS Expert Edition from AAPC for the 2019 edition. This is not a mandatory edition. If you have an option to get a different ICD-10-PCS codebook that you would like to use for this class, you are more than welcome to. We recommend this because this one is the one that's going to be used during your 2021 class, although you can get any edition or publisher that you like in the 2019 edition. I personally like this one because it comes with a few extra tips and tricks from AAPC on both exam prep as well as some of the anatomy that you'll find in PCS coding. So I'll show some of that to you here later on. For now, I've put up on the board here just a little bit about PCS structure, and you'll notice there's a few videos this week that talk about this as well. The concept of procedural coding systems from ICD-10 is that they want to always identify the same thing on each character. You may have noticed that CPT is kind of similar, that specific characters represent certain fields. But with PCS coding, they've taken this to a very specific branch, and they have you looking up these particulars based off of tables that put together the code each time. So let's look at that. We have here your first character is always referencing the section within the PCS codebook. So what do we mean by sections? Well, if you take a look in your textbook, you have several different sections listed on page 952. It starts from our biggest section, which is medical and surgical services. This means all surgeries, all medical procedures that are done to the patient will fall under section 0 for medical and surgical. Then we break down 1 through 9 and B, C, D, F, G, H, and X for all the other different types of services that are considered medical and surgical related, but not necessarily a surgery or a procedure. So you have specific services for obstetrics because those are so unique, they have their own section. You have a specific service for placement. administration, measurement and monitoring, extracorporeal or system assistance and performances, as well as extracorporeal or systemic therapies, osteopathic, other procedures, chiropractic, imaging, also known as radiology, nuclear medicine and radiation therapy, different variations of radiology, physical rehab and diagnostic audiology, mental health services, substance abuse treatments, and new technologies. So there's quite a few differences here. My goal is for you to understand that they are available, there are different sections, and how the characters are put together, as well as identifying maybe a couple of services, which section should it go to. But we'll be focusing mostly on structure and identification of medical and surgical procedures during this class. In future classes, you'll be able to explore all of the different areas within the PCS Codebook. So those are our sections. That's how they break down the specific procedures and services that we provide. The second area, though, is body systems. Now, you've probably taken several medical classes by now, from medical terminology to biology, AMP 1 and 2, and possibly some classes on principles of diseases or pharmacology, which all talk about body systems and the various breakdowns. These will come very much in handy when you're looking at PCS coding, because the first thing you have to identify are these three characters: the section a procedure is in, the body system it's applied to, and a root operation, which is character number 3. You'll notice on the same page and the next for 952 and 953, we have several different body systems that range from 0 through 9 and B through Y. In fact, most of these body systems are breaking down the body systems you're already familiar with, and some of them, like musculoskeletal, are breaking down even further to have one system for musculo and one system for skeletal. So take some time this week and look at those. Look at how they identify body systems differently than how you may have learned them as categorized together. This is one of the trickiest areas of PCS coding for coders, is the body systems and then root operations, which we'll talk about in just a moment. Okay, so be aware of that, and always remember to think about it. Think about what you know about the medical terminology. And when you look up any kind of procedure, always know what you're looking up. If you're not familiar with a term, don't be afraid to ask. Don't be afraid to look it up online. One thing I tell my students a lot of times, especially with coding, is there's nothing wrong with Googling a term to identify it. But remember, Google is your friend, never marry her. So meaning that it's up to you to make the determination if the information you found on Google is correct. Okay, so the third section we have is our root operations, and this one's kind of a big deal. I want to take a pause for a moment before we move on the different sections and talk about these first three. When you're selecting a code with PCS, they pull up based off of tables, which look at those first three characters to identify what table should you be in and where do you find the details on that code. So these first three areas are especially important. But one thing you'll notice in PCS coding is your alphabetical index, which is kind of missing on here. Alphabetical index, just like before, is going to pull up your procedures based off of the main term or action that's going on. So just like when you looked up CPT codes, you may have started with, what are we doing? But here, it changes just a little bit. In procedure coding systems for PCS, we look in the alphabetical index over what's the purpose of our procedure. And this is what we identify as the root operation. In many cases, the purpose of the procedure can be several different root operations depending on what was completed. So it's up to you to read through everything and make sure you understand. In the back of the PCS Codebook, there is actually a couple of appendices that are meant to help you in identifying this. And if you have a copy of it, go ahead and look in the back of your PCS Codebook and follow along. If you don't have a copy of it, rest assured, you do have access to 3M this term, which you should be using in order to look at all of your PCS codes, as well as other codes throughout this module. One thing that I want you to keep in mind with PCS coding is that you will be able to find it sometimes easier on 3M, but you can also look at the code book itself to see exactly what does that look like. Okay, so I'm going to look in the back at my Appendix A, which is my root operations. So these are definitions and details about each of the root operations available based off of the section that they apply to. You may have noticed that root operations, as listed in your coding book, can change. So the biggest one we focus on is medical and surgical section, or section 0. And the root operation definitions will state that medical and surgical section, and it lists each of those root operations. Now, in my version, and it should be in your version as well, it goes on to say root operations for obstetrics, which have some unique ones, and then placement, administration, and so on for each of the different sections that's available. So it's important to be aware that root operations can change depending on the section that you're in, and will only be available for that section. In Appendix B, we get to our body part key, which actually correlates with character number 4. The reason I point this one out is because the ICD-10-PCS value is the body part that they identify that you are having a procedure done to. That's the body part within the body system. For example, if I think about the mouth being part of the gastrointestinal system, I would have a procedure to the mouth most likely identified under body system for GI, and then body part identifying mouth. Now, depending on where I'm at within the mouth, that could change. So you have here a lot of anatomical terms, and they correlate to the body part itself according to the PCS classification. For example, if you were to talk about a procedure to the abductor brevis muscle, this would be identified under PCS as upper leg muscles of right or left. And so sometimes they're going to go very specific in the terms and expect you to correlate that to how they've broken it down. So it's very important that you're very familiar with these. Now, in the beginning of most PCS code books, sometimes at the end it depends on the publisher, but in the version that we recommend for this class, we have several anatomical illustrations, which are very handy both for coders because they're labeled and give you all kinds of really great detail, but also for when you're taking your exam, because you'll find that there'll be an anatomical reference that you may not be familiar with, and you can come in here and look at these pictures in order to identify what part are we talking about. So you'll see here on the mouth, when I mentioned the mouth as the digestive system, there's actually quite a bit of anatomical definitions within the mouth that are labeled here. And so you should be able to kind of see that in the video here. Okay? Again, this is something that will vary from book to book, and you'll notice some versions, some publishers from AAPC to AHIMA to... Sorry about that. Looks like we lost our microphone. Some publishers from AAPC to AHIMA all the way to Optum and some of the other carriers will have different variations and different tips and tricks within their code book. So that's just something that is a preference that you as a coder will eventually come to have a certain edition that you like. So just kind of keep that in mind. Okay, so moving on. The body parts are, as I mentioned, are identified in your Appendix B. And I'm going back there in my book now. Anatomical terms are going to be how they organize that. So you'll go alphabetically. And this is just meant to help you. You wouldn't look anything up there. You would just simply be referencing the Appendix B if you have an anatomical term that you're not familiar with to identify where would it correlate to as a body part within your PCS Codebook. Okay. So that one is that. Some of the other ones you will not find as useful all the time. So it's going to depend on what you're using your appendices for. So we'll look at the next one is approach. So for your approach, this is all about character number 5. And so at the point where you get to approach, you've already identified this was a medical and surgical section or something else, what body system you're in within that section, what the root operation is, or what was the purpose of the procedure, what type of procedure you were doing, what the body part is, and you get to a section of approach. Now in your PCS Codebook, and some carriers carry this, one of the tools that the AAPC provides on page 53 of the Codebook is an approach table. Now this is something you can also look up online, you can put together on your own. You have all the information in your chapter book as well, where we talk about approach. So the identification of approach is how did we get to the body part that we did the procedure to. And there's a couple of guidelines about it, and there's a couple of rules. You'll notice that I did provide for you the guidelines for PCS coding, and you should make sure to read through those to be familiar with what they are. In the approach table, we have here always the same approaches. You have external, open, percutaneous endoscopic, natural or artificial openings, natural or artificial openings with an endoscopy or endoscope, and natural or artificial openings with percutaneous endoscopic assistance. And those characters are identified by a letter or a number that are always the same for that approach. So let's look at a person here. Let me grab orange. It's probably the closest to a skin tone. Okay, so we have our person. And they'll be one of the Simpsons. You'll probably see why I'm not good at drawing. Not exactly anatomically correct, but it'll do. All right, so we have a person here. Okay. Here we see that they're standing anatomically, okay? So our person here, if we're doing a procedure, let's say to the arm. On the outside of the arm, we don't have to make any kind of incisions, and so this would be considered an external approach. And in fact, external approach, according to the guidelines, is going to apply any time that you do not cut all the way through the skin. So if something's being done to the skin and they are in fact cutting your patient, but they don't cut through all the layers of the skin, it's considered an external approach. If, however, we wanted to go down into the muscle and the fascia, this would be open. Or even if we went further, such as cutting the patient open in order to get to those nice little organs inside. Okay, so if we make an open incision, this is an open approach. Seems fairly simple. What gets confusing though is when we do, instead of an open precision, if we do, let's say, a laparoscopic precision. So a laparoscopic incision is going to be a couple of cuts into the body with a nice little tube that goes in and does various procedures, does investigations, all kinds of different details. So that's a percutaneous endoscopic. Okay, percutaneous because we go through the skin, we're cutting in, and we're using a scope to get into, say, doing a cholecystectomy. when we're removing the gallbladder. Okay, now let's say that the patient needed to have a drain of the lungs, and so they put a huge needle into their chest, and they did a drain with the needle. This is going to be percutaneous, because they're not opening, they're not using a scope, but they're putting something directly into their chest, into their body to do the procedure. And then our last three are going to be natural openings, and you have the difference of natural opening, endoscopic, or natural opening with percutaneous endoscopic procedures. So let's see. If, for instance, we're doing something into the mouth, this is going to be natural opening without the use of an endoscope. This can also be done something directly into the ear canal. On a female, you can have vaginal procedures that are being done, and there's no scope done. If, however, we go down the throat with the use of a scope, then this is going to be natural opening with endoscope. And here I've used a common symbol in medical documentation for the term with, which is a C with a line above it. So this is common abbreviations for the term with. And then last but not least, now this one is natural opening or artificial opening with percutaneous endoscopic assistance. This does happen more with the males than the females, where they're going to go urethroscopic and possibly cutting through in order to remove tissue. So if they have to go into, let's say, the bladder and they cut into it or something of that nature. That one's not going to be commonly used. Okay, so we have to identify what is the approach for our patient, and that's going to be on our 5th digit. Now, something about the code book that you should be aware of is once you've selected the first 3 characters, your section, your body system, and your root operation, then you get to what's called a table. And you can see an example of that over on page 961. Here we have a medical and surgical procedure, which is identified at the top of the table by the number 0. To the heart and greater vessels, which is identified also at the top for number 2. And for the purpose of dilation. That's your root operation. What is the purpose of our visit? We're dilating something. And so that's identified with a character 7 under root operations. And so the way the tables work is they break that up for you. They say, here's the first 3 characters, and here's the rest of the information that pertains to those 3 characters. So you're not going to see all of the different options that you may have or be aware of are available. For example, I'm going to put this table up here on the board for you. Okay? So we have here section, body system, operation. Okay. And then they've given that to you, 0, 2, and 7, and they give you the definition next to it. You have medical and surgical, heart and greater vessels, and dilation. And then below that, you'll see body part, approach, device, which we have not yet talked about, and qualifier. Okay? And here, it's also important to notice that this particular table they're giving you an example of has more than one table option. What that means is that you may see repeating information or you may see different information within the table. And depending on what information you are looking for, it's important to always read up and down. Make sure that you have everything that is available for your code. So I'm not going to write this entire table because you should be looking on here with me, but I want to show you why this is so important. So you have 0, 1, 2, and 3, F through X, and R. Okay. So no R. So if I'm looking at this and I'm saying I want to find the information out for my procedure and I'm not finding it, I need to make sure I'm reading everything that's available under this table header. All right, so that's kind of how it's broken down here. The reason why I mention that is because you may be under the first part of this table and sitting here saying, oh, okay, I'm looking for something very specific and I'm not seeing it, and maybe the procedure you're looking for is the left pulmonary artery. And you look at all of the options of 1 through 3, which are all coronary arteries, and then you look at the options of F through X here, and you're not finding it because it's only listed under R. These are important reasons that you should always read up and down and make sure that you read all the tables under 0 to 7. Sometimes this will be repeated on more than one page within the PCS Codebook. And so you may see everything you think is here, but it's really on the next page with that same header of table 0 to 7. So when you're looking up these characters, you have to put them together based off of all the information in the table, and you have to make sure you're in the right table for your section. Now, I know that may be a little confusing, so let's look at it a little further and let's talk about those last two characters. You have your last two characters are device and qualifier. And here they're represented on your table as device with several different options and qualifier. Under device, it doesn't always necessarily mean a device will apply. So sometimes you'll see the placeholder character Z, as in zebra, identifying that this doesn't apply to this code or this procedure, or no device is appropriate. And it's very important that you become familiar with that Z because you will use it oftentimes in device and qualifier or in one or the other. Your qualifier is just kind of that extra anything goes. It's a Mod Podge of any other options that don't fall within the first 6 characters of your PCS code. And so when you look at qualifier, sometimes there's absolutely nothing that can be qualified, and the only option you have is Z. Other times, you may notice the difference between coronary arteries, which have the option for qualifier 6 or Z, but the option for pulmonary arteries has the option for T or Z. And when you look at that on page 961 of your textbook, you can see that those qualifiers are different and would only apply to the body parts that are identified in that part of the table. So that's the reason you need to make sure you look up and down and always build your code when you're looking at PCS codes. We're almost done with this part, but before we finish, I wanted to talk to you about how to build a code. So we're going to code one of the scenarios in the textbook here. Okay. If we look over at page 962 and 963, we can see the table for plain radiology, and we can see the information for Let's Code It. So we have a patient, Montel, who is in a car accident and his right knee is hit against the steering column. He was admitted into the hospital and Dr. Tompkins took on a high osmolar x-ray of his knee. Okay, so we're going to change our table here, and we're going to look for the section, which is going to be a radiology, so we know it's imaging. The body system that the imaging was done to, well, that to me sounds like it's going to be his lower extremities. That's it's his knee specifically. So we're going to look for the body system for lower bones, because we're not just looking at the knee, we're looking at the entire lower area. And then what is our root operation? And that's going to change depending on what system you're in. And in this case, the root operation is plain radiology, meaning just an x-ray. The purpose is to do an x-ray. Okay. And let's get some of this open here for our procedure, because I want to show you how we're going to pull this together. Give me 1 second. Okay, so they've given you a table, which I'm going to be replicating on the board, which is on page 963, pulled directly from your coding book. In fact, if I look in my PCS Codebook, if you have one, you can follow along there as well. You should be able to see table BQ0. That table is going to be under B in the back of the code book, because you're going to go first numerically and then alpha when you're looking up codes. So coding table BQ0 is going to be found on the bottom of page 663, if you have the same edition codebook as I do. Okay, and so this is imaging done to a non-axial lower bones for plain radiography. Okay, and we're just going to throw in some little demonstration of how we look at that table here and how we build the code from this. So I want you all to pay very close attention to this part. Okay. Give me 1 second. This is the moment where your instructor has to tell the computer to keep recording. Okay, so we're just a little over 22 minutes here, so we want to make sure, 32 minutes. So we want to make sure to get this in before we're done with this video. So plain radiology of the knee. We find our table is BQ0, and this identifies imaging, the lower bones, and plain radiology. And again, it's your goal to be able to identify the areas and the characters mostly in this class. You'll get a feel for how to find those later on when you take a more in-depth version. Okay, and these tables are broken down by several different areas. Let's just do this real quick. Okay, perfect. And I love this one because you'll see exactly what I meant by repeating information. And I'm sure you love me for the squeaking. Almost there. Okay, so we have our approach, device, and qualifier. And in here, you'll notice that 0 and 1 are listed in the first option as well as the second option. This is for hip right and hip left. And you'll notice the first option has high, low, and other contrasts, 0, 1, and Y for the approach, versus none. You'll notice there are no devices available for either, and there's no qualifiers for the first option, although there is an option for a qualifier on the second. Okay. Then we have femur, right and left, Z, Z, 1 and Z. And again, you should be looking at this table with me in your code book. I'm just showing you how you would pull this up. Okay, then we have our knees, 7, 8, and ankles, G and H. And we have options for these, 0, 1, Y and Z, Z and Z. And then we have D, F, J, K, L, M, P, Q, V, and W. And you'll notice this one has Z's all the way across. And then our last one under this table is X and Y, 0, 1, Y, Z, and Z. So you should have been following along with me in your textbook. If you had this online, make sure that you have these pulled up when we're talking on these videos. Okay, so when I look at this table, I'm looking at my patient now, which had an issue to the right knee. So we're already identified as the lower bones as our body system. We already have the first 3 characters. And so what we do when we get to this point, we say, what is our approach, or what is our section? It's B for imaging. And so I'm going to bring that here under my code building, because this is the code that I'm going to report. Q for body system to the lower bones, and 0 for the root operation, which is plain radiology. Okay? And always make your zeros with a line through them. Remember that there are no O's or S's in PCS coding. Okay? Or I'm sorry, 5s, not S's. Okay, so we keep going. And the next thing you want to do is identify which part of the table you're in based off of the body part. So you'll see how some of these repeat. That means if you find the body part is 0 or 1, you'll need to look at both of these tables to see all of the options, because you may end up going, I don't see my option anywhere. Make sure you look up and down. Now for ours, 0 and 1 are both hips, so we don't need those tables. The next section, femur, right and left, what is the femur? That's the lower leg bone. Also not our option. But when we get to the third part of the table here, we have 7, 8, G, and H. 7 and 8 are both knees. And so we know our next one is going to be from this table. Before moving further, we have right or left, and we know it was the right, which means our next character is going to be 7. And we can just throw that up there. And we want to read up and down to make sure that 7, or the right knee, is not repeated anywhere else in other parts of this table. It's not. And so now we read from left to right. Our approach, we have the options of 0, 1, Y, and Z, which apply to high and low osmolar, other types of contrast, or no contrast at all. This is the dye that's put into the body in order to make it glow under X-ray imaging. So I want to look back to my scenario. He was admitted to the hospital, and Dr. Tompkins took a high osmolar X-ray of his knee. So we know now that there is a contrast for high osmolar, and that's identified by the 0 here. So I'm going to write that as my approach for my 5th character. The last 2 are actually really simple. There is no device or qualifier for this type of X-ray, and so we just throw in ZZ. And now we've completed one PCS code together. We have our code identifying the section, body system, and root operation, which gave us our table. And from the table, we identified the body part, the approach specific to this type of section, and the fact that whether or not there was a device or qualifier. And the code we report is BQ070ZZ. That's all for today's video. The last 2 sections, conventions and principal procedures, make sure you read in detail some of the exercises and details within your code book, as well as some of the opportunities we'll be looking over conventions as part of our discussion for this week. If you have any questions, feel free to let me know. Feel free to send me a message if you want something reviewed under Coding with Miss Melanie. And until next week, we'll talk to you then.